Welcome, everybody. My name is Doug Posson. I'm the Executive Director of End Homelessness St. John's, and I'm joined by a colleague, Melissa Kosh, and Melissa, you can introduce yourself.
Yeah, thanks, Doug. So, hi, my name is Melissa Kosh. I'm the Regional Director of Primary Healthcare, Chronic Disease Prevention and Management with Eastern Health.
Thanks, Melissa. So we're co-presenting today on our work in developing a harm reduction response for St. John's and how that came about through our COVID response and where we see opportunities to continue this unique partnership moving forward. So just a bit about End Homelessness St. John's. We exist to prevent and end homelessness in our community here in St. John's, Newfoundland and Labrador. And we work collaboratively with our community partners, our public system stakeholders like the Housing Corporation, our health authority, and working with those folks, we lead the coordination and integration of a system-wide planning through our community plan to end homelessness so that we can position St. John's to become the next community in Canada to end homelessness. And although we talk about ourselves doing system planning work, we do serve as the community entity through Reaching Home. Our vision at End Homelessness St. John's is to work towards a place where every resident has a place to call home. And we talk a lot about the idea of ending homelessness and that being daunting. And our work every day is to try and make that less abstract and make that goal more feasible. And that's why we chose the tagline, "We can end it," because we believe we can end it. And our team and our colleagues, we like the idea of the systems change. And hopefully you'll see through our presentation today that the pandemic that caused so much systems change has had a really positive benefit for our most vulnerable neighbors here in St. John's. So we're built around 5 key priority areas at Homelessness St. John's, and sort of the COVID pandemic became its own priority area as we were transitioning out of the city of St. John's in the spring of 2020. So our 3 action items are systems coordination. So that's for our work around coordinated access, which we've rebranded Coordinated Access to Homes. Knowledge mobilization, in which we are working with our community partners to set up HIFIS 4.0 and a shared management information system. And then community investment. So how do we coordinate our efforts? How do we use evidence to make a difference? And how do we use our investment money in funds and resources to invest very strategically? And underpinning that is stakeholder engagement through the work we do with our community and the leadership and advocacy that being a system planning entity requires. So like most communities, when the COVID pandemic hit and closed our community here in St. John's, we were all glued to our TVs. I know I was glued to the TV every day watching the Prime Minister's briefing. And it was then in late March, just a few days before we were even on our own as our own entity as End Homelessness St. John's, after leaving the city, where we heard Reaching Home was going to be investing substantial monies to support vulnerable folks around the country. So we knew we were going to be getting an influx of funding. So as a part of that, we expedited the launch of our program called Home Connect, which is our online housing inventory. And that facilitates private market rental opportunities with our community partners who are serving folks who may be shelter stayers or who are experiencing homelessness or at imminent risk of homelessness. So we expedited the launch of that. And then by the summer, as the funding had come through and we were able to work with our community advisory board, we prioritized having a designated hotel site for shelter clients who were being screened in for COVID testing. So anybody who was identified as needing that test, there was a process developed in partnership with Eastern Health and our community partners so that those folks could be safely transported to a designated hotel site. And I guess, St. John's being fairly unique around the country, a lot of larger urban areas would have bought hotels or had arenas serving in that response. We were able to work with our hotel in our community, and we continue to do that today. And then by the fall of 2020, like other community entities, we received a second round of funding. And so we worked with our community advisory board to develop additional priority areas, including supporting food insecurity initiatives, including developing a RFP for community organizations to provide housing supports and services. So all of this was going on at the same time that by winter, December 2020 and early winter, we were working with our colleagues at Eastern Health to engage in a partnership. And this partnership was really integral because we recognized that as an organization with very limited capacity on our own, in our community with limited capacity, isolating folks at a hotel who needed, additional supports, whether it was mental health, because they were maybe a mental health crisis, or substance use, required a lot more intervention and supports than our team and our shelter providers could provide. So all along this continuum here, we were working with our colleagues at Eastern Health to develop a harm reduction program that would be integrated as part of a COVID response, but with the grander idea that it would become a more community response that would be available to the community, especially in our case where in St. John's and generally in Newfoundland and Labrador, our COVID numbers were fairly low. So we knew working together, we'd have the opportunity to have our resources be scattered across the shelter sites, scattered across some of the street outreach services, and integrate those primary health resources in a way that hadn't been done before. So that was a really exciting opportunity. It took a lot of time. There were a lot of late nights, Melissa and I and our teams just working to figure out how we could do this and how this could make sense for our community and for our health authority. And that's kind of when it became online, was the beginning of winter of this year. So that was a bit of a COVID response. And we just published our annual update to our community plan to end homelessness. And within it, you can see a number of the responses. So, the isolation site at the hotel was critical. Delivering PPE was critical. Having support for food security for folks to remain housed and safe was critical. Another piece that we did is we jointly funded with our housing corporation a number of positions to springboard coordinated access to homes for our community, as well as working with our colleagues at Eastern Health to integrate primary health services into our community. And if anybody is looking for more information on our annual updates, you can check that out on our website, wecanendit.com. So that's a bit about our work leading up to the development and integration of the harm reduction program. And I'll turn it over to my colleague, Melissa, to describe a bit more about how that's unfolded.
Thanks, Doug. So just to say, guys, thanks for this opportunity. We're certainly very excited to share the work that we're done. We're very proud of how far we've come, and certainly feel like we've got lots to offer in terms of learnings throughout this whole process. So as I said, my role is as regional director of the primary healthcare program within Eastern Health. And so just a little bit about us. We are Newfoundland and Labrador's largest regional integrated health authority, and of course, offer the full continuum of health and community services. We're a tertiary care center. We have just about 313,000 individuals reside in the region and responsible for their care. Just about 13,000 employees. So we're a very large organization within a budget of $1.6 billion. And that'll become important later as I talk to you a little bit about how our program, from a primary healthcare perspective, fits into the bigger picture. Our vision is sorry, Matt. Healthy people, healthy communities. And so, I think I highlight that only because it's so incredibly important when we think about health and that integration from a social determinants of health perspective and ensuring that we've got healthy communities. So, essentially we work with community partners, work closely with community partners to enhance health outcomes. And just to highlight again our values, and certainly they align beautifully with those that of our community partners, so accountability, caring, collaboration, excellence, and respect. So the primary healthcare program, so just a little bit about us. We do lead the implementation of the primary healthcare model across the region, and we've got a broad geography. So while we're talking about services right now in St. John's, we actually have a large rural region as well that we would be responsible for primary healthcare to. From a primary healthcare perspective, we utilize a population health approach to service planning delivery, and we work, as I said, really closely with community partners such as End Homelessness St. John's. We work closely with clients, their families, peer support, those types of things. And a couple of examples of that, and I'm going to talk a little bit more about the Downtown Healthcare Collaborative now, is just that, as well as the Refugee Health Collaborative. So we work closely with the ANC as an example to provide primary healthcare services to our most vulnerable neighbors. Our annual budget is only $11.8 million. And I highlight that because it really speaks to the importance of leveraging our community partnerships and ensuring that we have this sort of approach where we're working closely. We are utilizing, I guess, resources in an efficient way and not duplicating roles. And so, when we had the opportunity to really strengthen this relationship within Homeless St. John's, it was a huge opportunity for us to be able to leverage that expertise and those resources in the community. So the Downtown Healthcare Collaborative, for those who aren't familiar, is something we're pretty proud of. It's a collaborative. It's a mechanism essentially for our government, for us as Eastern Health, for Memorial University and our local community partners such as Homeless St. John's to work together and pool resources, as I've just mentioned. The goal is to improve primary healthcare services and supports for the general population, with a focus on downtown St. John's and our most at-risk neighbors. It really builds upon the strengths of existing services and supports. And while it's been an incredible ride and incredible journey working with our community partners to build this collaborative, it has given us some opportunity as well to reflect on some of the gaps that we see in our community. And to Doug's point, that would be harm reduction programming and that integration with coordinated access to housing, or truly that focus on the social determinants of health. The Downtown Collaborative, from the Eastern Health perspective, really is primary healthcare services. So we have services like physician services, nurse practitioner services, social work, nursing services embedded into our community partner organizations. And so it's truly a mechanism to meet people where they are. And our philosophy really is every door is the right door. And again, just to highlight some opportunities, what we've observed is that, while we have this great opportunity and we're on the ground and we're embedded in organizations, it's how do we make sure everybody has access to those services? And so, if you're not connected to a community organization, then how do we reach you? And what you'll find when I work through this presentation is we found a really great way to be able to connect with people exactly where they are. So next slide. So I'm just going to build a little bit on what Doug had said, and how did it happen. So I'm, again, really proud of where we've come, and I think it's a really interesting story of how we got here. So, March 2020, we were faced with a situation whereby we knew that there were folks in our community that should we have an outbreak in the population, there would be a challenge in how we would isolate them and how we would provide them with the care and services that they certainly need and deserve. And so from there, a vulnerable populations task force was led by our government, and it was a fairly large scale response, a bringing together of all of our community partners and health and others to really ensure that we looked at all angles of how we would respond to an outbreak, and how we would support the population during the pandemic. And so from there, as I said, the potential to have to isolate was a pretty hot topic at that table, and we worked I guess as a health authority a lot around, well, okay, how do we mobilize those resources, and how do we provide harm reduction programming, for example, in a hotel environment. And that was something we hadn't done before. It was something that we certainly learned pretty quickly that there was some hoops we had to jump through organizationally, and challenges really that we had to face to be able to mobilize and operationalize that type of a service. We knew it needed to happen. We were just really challenged on how we would be able to, for example, redeploy staff that would typically work in a hospital, and put them in a hotel environment where things are, a little less controlled. It was work that we hadn't done as a health authority before. And so, we put our heads down and we thought, okay, well, how can we do this in our current context? And so I'm happy to report that we did it. It happened in a way that was a little bit different than we had envisioned, but essentially what happened was we were able to secure funding. we had made a case for what that harm reduction programming service should look like and what resources we needed. And so what we did is we actually went out and we recruited for those folks. And we had a very clear mandate, I guess, in terms of what type of expertise they needed. And that was really around mental health and addictions. And we built the program from the ground up. And it was a huge opportunity for us to get it right. It was an opportunity for us to be able to learn as we go. And as I'll share in a moment, you'll see that we certainly feel like it's working thus far. The other beauty and certainly shouldn't be underscored is that the importance of co-designing this with and Homelessness St. John's as our community partner. And so again, leveraging that expertise and maximizing our resources. And so it was identified again very clearly, and certainly part of our values and how we move forward is that integration of health and housing, and recognizing that without that we won't have improved health outcomes, we won't have improved housing outcomes, and we won't have that long-term impact that we certainly both of our organizations are striving for. So I talked to you a little bit about our current state. So as I said, we really have embraced this partnership. And so what I can say to you is Doug and his team and myself and my team, we plan together. So we've had several planning days where we sit and we talk about what our current state is, what our future state is, what our vision is, talk about some of our opportunities or barriers and challenges. And so right now we have on the ground registered nurses. We do, it's as Doug has said, this really started as a COVID pandemic response, but it's become much more than that. That said, we do provide a COVID response. And so we have 24-hour-a-day access to registered nurses to support the hotel. So they do things like COVID swabbing, they assess individuals and provide intervention where needed. They provide mental health supports. They provide harm reduction programming to individuals that are in isolation. We also have a nurse practitioner. We've recently added a pharmacist to our team, and we are in the process of onboarding an occupational therapist. We also have a social worker and who is focused on addictions counseling. And we have just recently put in an application to Health Canada to fund peer support. We will, in some way, shape, or form, find a way to integrate peer support. That was always part of our planning and our vision, but we're leveraging what resources and I guess and funding we can to build this team. Gosh, I lost my train of thought there. Sorry. I guess in terms of services, pardon me, we do shelter and partner organization visits. And so we have a schedule whereby the nursing team in particular will make those visits, and the nurse practitioner. And they've made really strong connections with the folks on the ground at these shelters. They've come to know the individuals that we serve, and they meet them exactly where they are. And so they could be providing anything from vein care to routine screening. They could be providing, the basic necessities, and building that relationship so that they can open the door to be able to meet the needs of the client. We do walk-in clinic. So that has been an interesting journey as well. And so it's a nursing clinic, but what we found is that, again, our most marginalized clients they come to the clinic. And they get care where there's no judgment. They have full access to that team. And we have clients who tell us that they haven't received this type of care in many, many years because they have been afraid to access care in other areas. We have street reach programming. So we partner with folks at Thrive, and we do street walks several times a week. And as I said, we've done COVID testing as well as COVID vaccine, and we have done flu vaccines as well for the population. So in terms of future state and where we're headed, several of what I'm about to talk to you about is actually in flight, but it's interesting because it certainly we're ahead of where we thought we would be, I guess, in terms of our planning. And so we are sitting at the table from a coordinated access perspective, and that has been incredibly enlightening and has been a real opportunity for us from a health perspective to provide that lens, but also to insert our expertise, I guess, into a process that we certainly feel brings great value. The integration of occupational health services and addictions counseling. So again, in terms of lessons learned, we want to get this right. And so we do have occupational therapy services as part of our downtown collaborative. And so we talked a lot about how we can leverage that expertise and ensure that particular profession is integrated into the team in a way that's really meaningful. And so we have been able to take that person and their expertise and align them with this broader team. And so we look forward to her being able to offer that expertise and those skills, I guess, from a harm reduction perspective, as well as addictions counseling. We've started just recently offering a managed alcohol program in partnership with another one of our community partners, the Women's Center. And again, we see this as an opportunity to be able to show how we can do this and how we can do it well, and take a sort of a kick at the can in terms of managed alcohol. HIV and hepatitis testing and treatment, again, we've started that, and we're pushing the envelope a little bit from what we would traditionally do in health. And so, for example, hepatitis treatment tends to be quite expensive. And one of the challenges is, while folks often can get funding for the first round of treatment, the second round of treatment tends to be a little bit more of a challenge. And so, and of course that has impact on outcomes, on all sorts of outcomes. And so what our team has done, again, with their expertise and truly meeting people where they are, is they've said, okay, a client presents to a nurse practitioner who begins the process for hepatitis testing. She partners with the pharmacist who has an expertise and very much has lots of connections in the community to make sure that happens seamlessly. And then they'll send them to the nurse, who then will talk to the individual about vein care and ensure that they don't end up with a repeat infection. And again, that ongoing connection ensures that without that, so that they don't have a secondary infection, they don't have to go through that process again in terms of the treatment. So it's it's really been an eye-opening process, and routine screening. So what we've learned is there's many individuals in the population that have in our community that haven't had things like pap tests, that haven't had routine blood work in many years. And so by building this relationship and meeting people where they are, we really truly are able to provide preventative care, true primary health care that has an impact on long-term outcomes. Next slide. So I won't spend too much time here, and I certainly appreciate that this is a very busy slide, but I wanted to share, I guess, a little bit about how we are evaluating the project. And so to say as well that, Doug and his team have been a part of developing an evaluation framework with our partners at the Newfoundland and Labrador Centre for Health Information, and that we've even taken it a step further and had members of the community advisory boards sort of sit with us and say, does this make sense? And does this meet the need of the community? And so I won't go through this sort of step by step, but it's certainly there for those that are participating today to have a look and say, okay, well, this is how we kind of worked our way through. I mean, the thing we're most interested in is outcomes, of course. But we also recognize that this is, our opportunity to show how valuable this type of programming is. Our funding is year to year. And so we really need to be able to say to our decision makers, this is the value it brings. These are the outcomes that we have moved, and we're doing that together. So just wanted to speak to that. And that's it. So, I think we've just shared a couple of quotes there in terms of some of the feedback we've gotten on the programming. We've started the evaluation, and so we've done some client surveys. We've had, again, incredible feedback that this is meeting the need of a community. That, please don't stop. And our staff, we've had a 100% retention rate. And so, that speaks for itself in an organization the size of ours, that these individuals as part of our staff they're completely and utterly engaged in the work, and they love coming to work every day. So I think we're doing something right. That's it for us. I certainly appreciate you all taking the time to hear from us.